Hi everyone. This month I wanted to talk about something that's actually been bothering me, and that is tennis elbow. And we've actually had a lot of our golfers dealing with this in the clinic too. A bunch of people coming in dealing with elbow pain. So the gang and I thought it'd be really fun to share some of our sort of pro tips to take care of our own bodies, so that you can do the same thing and hopefully avoid these injuries and keep playing golf and swinging the club and taking divots without that horrible feeling in the elbow. For me, it's when I start to shallow the club in my downswing, I'll feel some pain in my trail elbow on the side, and that's called lateral epicondylitis, otherwise known as tennis elbow. And it can really be a big deterrent to swinging the golf club properly. A lot of people get affected at impact with it as they hit the ground. And feel that ground force coming up through the club. They get a little shock into the elbow. Typically that can be more of a golfer's elbow situation, which would be the inside of the trail arm. But for me, it's the outside. And like I mentioned, as I'm bringing that club down and shallowing it, as I transition down from the top of my swing, I can feel that strain in the lateral side of my trail elbow. So what I like to do, as I'm trying to treat myself literally right now, is I take an ice cube and I just put it inside of a washcloth, and then I hold the ice cube with the washcloth so I don't obviously freeze my fingers, and then I just rub the ice cube directly on my skin. I usually set a timer for about 3 minutes, and then after 3 minutes I'm done. And the other nice thing the towel does, it helps collect the melting water, or the melting ice, which turns into water and drips on the floor and makes a big mess. So we're trying to avoid a mess, and we're trying to avoid freezing our fingertips by holding it with a washcloth. So we're just going to take that, rub it on the skin in a circular motion or sort of an oblong motion. I'm searching for those areas that are painful and tender, and for me it's kind of around the back side of the elbow. For some of you it might be down more in the muscle tissue. So you're just looking for those spots, and you can see I'm continuously moving the ice cube. At no point do I stop and hold the ice cube in one spot. What we're trying to avoid is freezing your skin. So we want to make sure we're keeping that ice cube moving for 3 minutes. This is called ice massage. It's a really great technique for reducing inflammation in your soft tissue and around those joints. The inflammation is what's causing the pain. Inflammation irritates nerve endings in your body, and those nerve endings get all ticked off, and they send impulses to your brain that your brain interprets as pain and as an irritant. So we're trying to use the ice to help reduce the inflammation in the soft tissue, to get that chemical irritant away from the nerve, to help the muscle tissue heal. Another crazy thing that happens in the human body whenever you have pain, anywhere in your body, the muscles in the area you're experiencing pain immediately start to atrophy and get weak. So we want to make sure that we are getting ourselves through that acute pain phase as quickly as possible to reduce not just the discomfort, but also reduce the weakness that is associated with prolonged acute pain. So 3 minutes is up, my ice massage is done. I still have a little bit of the ice cube left, which is cool. We're going to pitch that in the garbage and just use the towel to kind of dry the arm up, and we're good to go. Let's go hit some golf balls.